We're joined by Liz Dallimore, Managing Director of Argenica Therapeutics. Liz, thanks for your time.
Hi David, how are you?
Argenica Therapeutics, for people who don't know, what's the drive behind the company?
So Argenica Therapeutics is developing a drug. It is a neuroprotective drug, so a drug that is able to protect brain cells following injury. So for example, after stroke, traumatic brain injury and hypoxic ischemic encephalopathy are our main kind of key indications we're looking at. The drug itself has come out of 10 years of preclinical work from the Perrin Institute and the University of Western Australia. So it's got quite a long history and we're finally getting to the point where we're taking it into the clinic, which is exciting.
Touching on that, phase 1 trials, a key milestone for any company such as yourself. What does it involve? What's the timeline and what should investors be looking for?
Yeah, sure. So it is a huge milestone for the company and in particular for our Chief Scientific Officer, who is the inventor of the drug. So 10 years of his hard work has led us to this point where we have dosed our first healthy subjects with the drug, which is really exciting. So to move from a preclinical to a clinical company. So really the aim of the phase 1 trial is to show that our drug is safe in those healthy volunteers before we progress it to a phase 2 trial in stroke patients. The trial itself is quite short. We have almost finished completion of dosing of our first cohort. We have 3 more cohorts to go, so by the end of this calendar year, early January, we'll have those cohorts dosed and completed, and then moving towards our phase 2 trial in stroke patients. Yeah.
And other applications? Are there other applications for this technology?
Yeah, absolutely. So we see it as a platform technology, so the mechanism of action of the drug lends itself to quite a few neurological conditions. So the main priority is in ischemic stroke, but we also have really exciting preclinical data in traumatic brain injury, and we're progressing that line of research, in particular in mild traumatic brain injury or concussion. And the other exciting area is in hypoxic ischemic encephalopathy, which affects infants. So hard to say, yes, bit of a tongue twister, I've got it down pat, but it's where there's a reduction in blood flow either immediately prior, during or post labour, and it results in horrific disabilities to infants like cerebral palsy, even milder learning difficulties and things like that. So huge unmet need in that area for those infants. So we've got some really exciting preclinical data, so looking to progress that application where we can.
Really important work that you're doing, exciting times ahead, key milestones already hit and more to come. A company to watch. Liz, thanks for your time.
Thanks, David.